Joining us today is leading women's health expert, Dr. Lauren Streicher, here to discuss estrogen during menopause. Thank you so much for joining us, Dr. Streicher.
Well, thank you for having me.
So, Dr. Streicher, tell me, how long do hot flashes last and how can they be controlled or eliminated?
Well, first of all, up to 80% of women experience hot flashes, and they generally have no idea that on average they're going to last 7 to 12 years. And so many of my patients say, oh, it's not going to last too long, and I have a very healthy lifestyle, so I'm going to do my yoga and I'm going to eat healthy, and that's going to help alleviate those hot flashes. And the sad truth is it just doesn't work. What does work is hormone therapy. Every clinical study has shown that hormone therapy is going to do the best job to reduce or alleviate those hot flashes.
So, how does hormone therapy have does hormone therapy have a higher dose of estrogen than birth control pills, and is it dangerous?
You know, it's interesting because women generally are very comfortable taking birth control pills, which has a relatively high dose of estrogen for the purposes of preventing ovulation and, of course, preventing pregnancy. Hormone therapy, on the other hand, has a low dose of estrogen to alleviate hot flashes. And in fact, if you do a blood test of a woman who's taking hormone therapy, her estrogen level is going to be even lower than it was before she went through menopause. So while women worry and are, of course, concerned about if there's going to be any dangerous side effects from hormone therapy, it's very reassuring to know that the level of estrogen is actually lower than it is with birth control pills. But of course, you need to check with your healthcare provider to find out whatever risks and benefits might be critical for you.
And now, some say estrogen therapy increases cholesterol. Is that true?
It's actually not true, and this is a big concern because midlife is when a lot of women are told for the first time that their cholesterol or their triglycerides are elevated, and the last thing they want to do is to take a medication that's going to make it even worse. But in fact, in many cases, estrogen will lower cholesterol. And oral estrogen, which is taken by mouth, not only can lower cholesterol, but it's good to know that it might increase triglycerides. Transdermal estrogen, which is administered through the skin, not only can decrease cholesterol, but in many cases it will also decrease triglyceride levels.
And now, does estrogen therapy cause weight gain?
This is the other big question because, of course, many women as they go through midlife tend to gain weight. And there are a lot of reasons for that, but we do know in the clinical studies that estrogen is not associated with weight gain. So if someone's struggling and if they're taking hormone therapy, it's not because of the hormone therapy.
And now, is estrogen therapy covered by insurance?
Well, as a physician, I never promise any patient that any medication is going to be covered by insurance because, of course, every policy is different. But what I can tell you is it's very unlikely that an unregulated compounded hormone or estrogen therapy is going to be covered by insurance because safety has not been tested in those products. A prescription that is FDA approved and that you can get at any pharmacy is generally going to be covered by insurance.
And what solutions are there for vaginal dryness that accompanies menopause?
Yeah, I'm glad you brought up that aspect of menopause because while 80% of women have hot flashes, 60% of women experience vaginal thinning and dryness. And there are a number of prescription options, both hormonal and non-hormonal, that can help. But a lot of women aren't aware that they can start with an over-the-counter, long-acting moisturizer. And in addition, it's really important to use a good silicone lubricant at the time of intercourse to ease penetration and decrease pain. But the point is there are solutions for hot flashes and vaginal dryness, and women should not go through menopause without that kind of help.
And what are the main risks associated with estrogen therapy?
Anytime we talk about a medication, we have to talk about not only the benefits, but also the risks. And after the Women's Health Initiative was released in 2002 that specifically looked at health concerns like blood clots and cancer and dementia, women, of course, have been concerned if those are going to be an issue for them. So first of all, I would encourage women to read the WHI study themselves. You can find it at whi.org. And also to talk to their healthcare provider about risks and benefits for their particular situation. And if your own doctor isn't a menopause expert, there are menopause experts out there, and the North American Menopause Society is an excellent way to find one, and that can be found at menopause.org.
Thank you so much for joining us.
Thank you for having me.